It's my honor to share with my experience about MRgFUS in the treatment of adenomyosis. Adenomyosis is a common gynecologic disease. I'm the only person today to talk about this topic, so I'll give you a brief introduction. It results from the invasion of endometrium into myometrium, and it can be classified as focal and diffuse. The most common presentation of adenomyosis are abnormal uterine bleeding and dysmenorrhea. Choosing the optimal treatment for adenomyosis has always been difficult, especially for patients who want to maintain fertility. And the treatment options for adenomyosis could include both medical and surgical. Most medications such as progestin or GnRH-a are effective, but we found that when we stopped, the symptoms usually return. And conservative surgical treatment and some non-invasive interventions such as UAE are in limited success, maybe because of the destruction of the uterine wall or the decreased ovarian function or further complications. MRgFUS has been approved by FDA for the use in the treatment of uterine fibroids. And the aim of our study is to evaluate the efficiency of MRgFUS in the treatment of adenomyosis. To this end, we retrospectively assessed clinical information of 9 patients in our unit, and we found that the treatment can improve the clinical symptoms. Now we can see the symptoms severe score decreased from 55 to less than 30. And the same results was about for dysmenorrhea score. Also, we can find the increased hemoglobin level and the decreased CA125 level. We are glad to see that MRgFUS can improve the clinical symptoms, but also it with no complications and adverse events. However, when patient during the 6 months follow-up relapse, and we also get less satisfied NPV. Now, it is still an issue that how to further enhance the therapeutic effects and meanwhile reduce the relapse rate. For this purpose, we tried to investigate whether combined with some medication could result in improved outcome. So we take GnRH-a as a candidate. Because first, GnRH-a is effective for the treatment of adenomyosis, and some research also showed that it can enhance the ultrasound energy deposition in the targeted area. So we pre-treated 2 patients who have fertility requirements with the treatment of GnRH-a for 3 months. And we can find that the NPV ratio increased and the uterine volume decreased obviously. Here are some cases. The first case is focal adenomyosis. We can see we can reach the NPV ratio nearly 65%. The second case is the relapse case. The patient have a unsatisfied treatment, the first treatment. We have a low NPV ratio, and 6 months later, the patient went back to our unit with an enlarged uterus. And 2 months later, she decided to underwent a secondary treatment. And the second treatment can reach the NPV ratio nearly 60%. This is the combination case. We treated the patient with 3 months GnRH-a, and we reached a satisfied NPV ratio nearly 77%. And this is a diffuse adenomyosis. And we can see the first picture, the large uterus, the first treatment was disappointing. We can see so little so low NPV ratio. And the patient underwent 3 months of GnRH-a, and we can see the uterus volume decreased obviously. And we can reach the NPV ratio nearly 77%. And we can conclude that MRgFUS is a promising mini-invasive treatment for adenomyosis, which can lead to satisfied clinical outcome with no complications and adverse events. And it can be improved by combination with GnRH-a. Still, we need large sample size with long-term follow-up, and especially fertility and pregnant outcome. Thank you.
I think that's a great start to investigate this new application, so we'll be interested in hearing some more data, so that's great.
Thank you.